Tossing and turning, looking at the clock. 3:45, 3:46, 3:47. Time seems to stand still. You tell yourself, okay, if I can just relax this time, I can still get 3 hours of sleep before I have to get up in the morning. Battling insomnia isn't that easy. It's a condition that attacks one of your basic needs of life, sleep. Insomnia doesn't just affect somebody every now and then either. It's one of the most commonly reported health problems, with 1 in 3 people experiencing effects of insomnia in a given year, according to WebMD. I can personally vouch for the troublesome effects and negative feelings associated with insomnia, where it has transformed my once happy sanctuary of sleep into a now dreaded feat. So, I took it upon myself to learn more about this adversary, and today, I would like to inform you about the severity, signals of the different types, and methods of treatment for insomnia. Once we start with identifying what insomnia is, it's very easy to see the severe impact it can have on a victim's life. iSleep states that the average person needs 8 hours of sleep. However, some can function on less, while others actually need more. A lot is accomplished when we sleep. It's a way to rejuvenate mind and body by regenerating depleted cells, relax, and review the day's events. Insomnia gets in the way of these, though. Let's see how. Insomnia. It's a common condition where one has difficulty falling asleep, staying asleep, has an unsatisfying sleep. It's basically being awake when you want or need to be asleep. It can take thresholds of mild to severe and is broken down into 3 classes based on duration and severity. The weakest, transient insomnia, will never be more than a temporary disruption of the sleeping pattern for several nights. The milder form, acute insomnia, lasts a little bit longer, 1 to 3 weeks, and is frequently paired with an increase in worry or stress, but is treated when that stress disappears. Then a more problematic form, chronic insomnia, where one has symptoms for at least 3 times a week for over a month, and it's usually paired with another disease, according to the American Sleep Association. In addition to having 3 classes, there are also 2 types of insomnia. The National Heart, Lung, and Blood Institute states that the condition that 8 out of every 10 insomniacs have is secondary insomnia. This insomnia is a result of some side effect. Some common problems that cause secondary insomnia are situational stress factors, illnesses like heart disease, pain, anxiety, medicines that disrupt sleep, caffeine, tobacco, alcohol, poor sleep hygiene, which is where one might go to bed hungry or exercise right before going to bed, and lastly, a change in sleep routine. The other type, primary insomnia, is not brought on by their side effects, but is its own disorder. It basically means there is no reason or cause for it, it's just plain and simple, you can't sleep. This is according to eMedicine Health. It's a no-brainer that when you don't sleep at night, it's going to affect your lifestyle during the day. eMedicine confirmed that insomnia can definitely be a huge problem because it can cause sleepiness and bring about a lack of energy during the day. Even worse, feelings of anxiousness, depression, or irritability occur with the sleepiness. The ability to pay attention, focus on tasks, learn, and remember are that much harder to perform. It can really take your life too, because it's near impossible to focus on school or at work, not to mention the amount of time you want to put forth with friends and family when you're not getting enough sleep at night. I personally have seen a drop in my grades since being struck with this disorder, and now I'm going to demonstrate a common scene in the life of an insomniac. Hello? Yeah, I actually haven't had too much sleep the past couple nights, so I think I'm just going to stay in and take a nap. Alright. Hello? Yeah, I still haven't been able to get to bed yet. I think I'm just going to go to bed early, actually, and see if I can't catch up in my sleep. Alright, bye. It might seem unrealistic, but that can be a common scene in the life of an insomniac. Sleep just becomes priority number 1, and it just eats away at their life. Things don't get any easier in diagnosing insomnia either. In fact, eMedicine stated that the diagnosis is very thorough and tedious. A physician usually starts off with a medical history, psychiatric history, and a sleep history of the patient. Then a general physical exam looks to find anything abnormal through an assessment of mental status and neurological function. Then a list of routine medications and use of any illegal drugs needs to be gathered. Atypical answers to some of the following sleep history questions might possibly raise a flag to the physician that the patient does indeed have insomnia. The questions might be duration of sleep, time to fall asleep, number and duration of awakenings, time of final awakening in the morning, and length of daytime naps. The doctor also has to try to see if the patient has been introduced to any kind of stress or has any painful injuries. These questions are an important piece in diagnosing insomnia, and the doctor will often prescribe the patient to log the answers to these questions in a sleep diary. A sleep diary basically sums up all the patient's sleep habits and abnormalities for 3 weeks, so the doctor can later look at it and pinpoint the target problem, what it is that is causing the patient not to get their sleep. After diagnosing insomnia, the road to eliminate it does become easier. Let's take a look at some of the treatment options. The American Sleep Association stated that if insomnia is related to a known medical or psychiatric condition, therapy for insomnia itself is prescribed, but the main focus will be on finding appropriate treatment for the underlying condition, or the condition that almost feeds the insomnia. Once the big picture medical problem is taken care of, the insomnia goes away along with it. It's like killing two birds with one stone. And this leads to, however, there is a favorable outlook for insomnia. Many cases are easily reversed with the removal of situational stress in the case of transient insomnia, and even in chronic insomnia, medical and non-medical home remedies are generally successful in easing the occurrences. And it should also be noted that leading a busy, full, and satisfying life is the best defense against insomnia. Insomnia feeds off of stress, and if you go to bed when you had a good day, you're going to get a good sleep. If you had a bad day, you're going to go to bed worrying about it, and insomnia might occur. And like I said, better sleep habits and lifestyle changes do relieve the simplest case of insomnia. An example of some of these might be making sure the bedroom is quiet, dark, and quiet enough for sleep, following a routine that helps you relax for bed, like taking a hot bath, not exercising or eating a lot before bedtime, avoiding distractions such as TV, and going to bed while also waking up at the same time each day. Once it's known for sure whether you have insomnia, medication will be prescribed. The main medications used to treat insomnia are sedatives and hypnotics, specifically benzodiazepine. Some successful medications used to treat insomnia are Sonata, Ambien, and Lunesta. The doctor will prescribe the patient to use these for 1 to 2 weeks to help establish a regular sleep schedule. After 2 weeks are up, the doctor will see where they're at, because the patient can develop an addiction to these drugs. They should just be used as an ad-season basis and very sparingly, just to establish that sleep schedule in the very beginning. Melatonin, a chemical released by the brain which induces sleep, has also been tried in supplemental form. Perhaps the best option is cognitive behavioral therapy, and this targets the thoughts and actions that disrupt sleep. It's basically sitting down with a psychiatrist who specializes in sleep, and they'll rid you of all your bad sleeping habits, and basically you'll be forced to get a good night's sleep. One thing I stress is if you're in bed for more than a half hour, get up and do something productive, because you're not going to be able to fall asleep if it's been more than a half hour. And I've taken this advice. I've actually gotten up and watched a brief TV show, and then I went back to bed and I was able to fall asleep. It just relaxes you, and it does work, like I said. So as you can see, cognitive therapy is actually a better long-term solution, and is just as effective as prescription medication. Everyone goes through occasional insomnia. Insomnia interferes with one of the most vital human needs, sleep. Just like somebody robs a bank, insomnia robs us of our sleep, and most of the time it gets away with taking our sleep, but it can be caught and put away for a very long time. Insomnia will try to steal your disease, but it doesn't have to. If sleep is something you want, which it should be, it is something you will get, and nothing can stop you from being granted this wish, not even insomnia.